Suicide prevention was a focus of Tuesday's budget, with $298 million committed to addressing rising rates. The government is working towards zero suicides, but experts in suicide prevention and mental health say this amount is nowhere near enough to address these issues. Gerry Georgatos is National Coordinator of the National Suicide Prevention and Trauma Recovery Project. He told The Wire's Michelle Stephenson what difference these funds will make to the mental health sector.
$298 million over 4 years, $75 million a year will make very little difference contextually to suicide prevention. 1 in 50 Australian deaths is a suicide. 1 in 40 migrant-born deaths in Australia is a suicide. And 1 in 17 of our First Nations brothers and sisters in terms of death is a suicide. These are dramatic figures. And we're talking about a leading cause of death for 15 to 45-year-olds. $75 million per year will make very little inroads. Better than nothing, but it's nowhere near what should have been invested in. It should have been at least $1 billion a year in terms of suicide prevention. And suicide prevention means early intervention for the most part, and also after an attempt, post-intervention, crisis intervention, where we need to stabilise people steadfast, and we have a high rate of hospital admissions and a high rate of people who also make no clinical representation, that we need to actually invest through outreach. And actually outreach is the missing link, and that's not being invested in.
How will the money be allocated?
About $40 million a year over the forward estimates of 4 years will be towards aftercare services, so the follow-up care in the immediate months after a suicidal crisis or an attempt. And that's mostly through emergency departments, and most people get discharged on the day, and at best within a day or two thereafter an attempt, and even multiple attempts. And that's a reprehensible predicament that we haven't actually addressed, the supports that need to be put in place for the substantive follow-up care in terms of having a bed available for them and other supports resourced to keep them in hospital for as long as need be to actually stabilise them, and also for the assertive outreach that's actually needed on the outside to actually reach them in terms of through care, and also for the psychosocial facilities that need to be created, and those few that do exist ramped up in terms of the resourcing that they need in community for people to stay who actually don't have an appropriate accommodation or intrafamilial support to be supported by.
As you said, one key initiative is to deliver universal suicide aftercare and postvention services. So how important are these initiatives in saving lives?
They're vital. We've got to reach thousands, many thousands, tens of thousands of people in terms of hospital admissions, and hundreds of thousands in terms of those who have actuated self-harm and not just ideated self-harm, to support them. And if the investments aren't made, and they're not being made in terms of the outreach, we're not going to reach people. There's going to be no crisis intervention, there's going to be no post-crisis support, there's going to be no stabilisation, and there's going to be nowhere for people to turn to. So what we've created is still a languishing of people and a hospital system that hasn't been recalibrated to support people in terms of the investment that's needed to receive people on a substantive through care basis.
So the funds include specific funding of $79 million for initiatives aimed at Aboriginal and Torres Strait Islander peoples, including a culturally appropriate crisis line. What are the challenges for First Nations people finding support at the moment?
For a lot of First Nations people, especially remote living and regional living, there are no supports. For a lot of First Nations people, in terms of the urban masses where the majority of suicides are accounted for, most of them live in public housing and social housing. They're the poorest Australians after our homeless, and there's also the homeless that actually have a high rate of suicide. And a significant proportion, 1 in 5 of our homeless, are actually First Nations brothers and sisters. 1 in 3 of our homeless are actually also migrant-born brothers and sisters. They have very little supports and very little assertive outreach, very little relentless outreach, very little through care to turn to. The $79 million is actually over 4 years, so it's actually a very poor investment. It should have been $79 million each year at the very least, so we could kickstart something much more substantive. So we could put services on the ground in the remote, the region, and the urban masses where our crushing poverty is in our public housing rentals. And we've got to understand First Nations suicide as predominantly people living below the poverty line. 40% of our First Nations brothers and sisters nationally live below the poverty line, 60% in Western Australia, 75% in the Northern Territory. Nearly 100% of the suicides of First Nations peoples are below the poverty line. And to understand poverty and its stresses, we've also got to understand in general that the lowest quintile of income base for all Australians is the highest proportion, the most significant proportion of suicide and suicidality. So we're not reaching our poorest, and our First Nations brothers must be understood that they're the ones at the littlest ages, those living below the poverty line, and they also live a crushing type of poverty that other Australians living below the poverty line do not live. So we've set no substantive supports. Any investment that's above what actually already exists is worthwhile, but it's a long way short of what should be.
So considering suicide seems to affect people in poverty more than other groups, is it enough to just be investing in suicide prevention through this? Do we need to obviously invest more in actually alleviating poverty in order to make these measures effective?
We've got to have a concomitant approach, a two-pronged approach. One is actually poverty alleviation and the reduction of those stresses. People living below the poverty line are 20, 30 and 40 times the rate of dying by suicide from whatever aberrance or triggers than people living above the poverty line. So what takes your life above the poverty line is 20 and 30 and 40 times more likely to take your life below the poverty line, whether that be domestic violence, whether that be psychological abuse, whether that be crushing poverty and socioeconomic stresses, whether that be sexual assault. And sexual assault I mentioned because it is actually thematic in suicidality, but it's 20 and 30 times more likely to take your life below the poverty line than above the poverty line.
The government claims it's committed to working towards zero suicides. As you've said, this money doesn't seem to be enough, so what do you think they need to do in order to meet this goal of zero suicides?
To significantly inroad into suicidality and reduce suicidality, to set the supports up to actually reduce the suicide toll, and it is a can-do if the right investment is made, and that right investment is in the mechanisms and the levers such as relentless outreach, such as through care, such as resource psychosocial facilities, and such as in substantive aftercare in hospitals where that need be the case, and also in poverty alleviation. But poverty alleviation, setting that aside in terms of suicide prevention per se, the spend that should be made should be in excess of ideally $2 billion a year for suicide prevention, 10 times what is being allocated over the forward estimates. But in 1 year, and we spend $8 billion over the forward estimates, that will actually significantly inroad people who need support with suicidality and reduce suicidality. There is no greater legacy than we can have than to improve the lot of others to the point of changing lives, to saving lives. And that's the pressing issue of our time. The leading cause of death for 15 to 45-year-olds, the leading cause of death for our children, the leading cause of death for our youth is suicide, and the investment is a betrayal of those expectations.
Gerry Georgatos, National Coordinator of the National Suicide Prevention and Trauma Recovery Project, speaking with The Wire's Michelle Stephenson.